So now we are going to discuss the squamous cell carcinoma. A 70-year-old lady present with a non-healing venous ulcer in the leg, multiple ulcerated lesions in the face and lips. Biopsy is taken. So from biopsy report, what are the criteria of malignancy? So we have discussed this in a parotid tumor section. Criteria for malignancy from biopsy report. So in biopsy report, you will see the lymph node invasion, lymph nodes, and the mitosis index, like there are more mitosis or less mitosis. Then you see the nucleus cytoplasm ratio, NC ratio. In um, in malignancy it will be raised. So poor differentiation, okay, and invasion of surrounding structures, and there will be more chromatin, basophilic, it will be more basophilic. So these are the some criteria of malignancy. Okay, so 6 months later, patient develops cervical lymphadenopathy. How does cancer spread back to lymph nodes? So again and again, this question is coming, and we are discussing that tumor cells always secrete vascular endothelial growth factor C, and uh, this induce the angiogenesis, lymph node angiogenesis, or lymphatic vessel expansion in the primary tumor and draining sentinel lymph nodes, thereby promoting the lymph vessel. So this can be through permeation. For example, there are lymph nodes and these are the tumor cells, so they can invade directly and go in. So this permeation and embolization through vessels, this come, and lymphatic angiogenesis, as we discussed, that vascular endothelial growth factor can do this. So excision done but not enough. Okay, so excision done but not enough. What will you do? Re-excision. Okay, what is frozen section? It is a pathological laboratory procedure to perform rapid microscopic analysis of a specimen. Yes, and this is usually in the skin lesions. If it is not enough, then do re-excision. That's the beauty of frozen section. How the specimen is fixed. So the surgical specimen is placed on a metal tissue disc. So you have this metal tissue disc, so you place the specimen here. I know most of you have this in medical school. This was the famous practical session of the patho, I think in third year. Yes, so the surgical specimen is placed on a metal tissue disc, which is then secured in a chuck and frozen rapidly to about -20 to 30 degrees centigrade. The specimen is embedded in a gel-like medium called the OCT and consisting of polyethylene glycol and polyvinyl alcohol. Subsequently, it is cut frozen with microtome portion of the cryostat. The section is picked up on glass slide and stained, usually with hematoxylin and eosine, HEA, and then look under the microscope. Okay, so I will explain in short simple words that, okay, so we have placed this tissue, this specimen, on the tissue, what was this, metallic tissue disc, and then what happens that we have the it is frozen. You freeze it under -20 to -30 degrees centigrade, and then this specimen is embedded in a gel-like medium. So we put the medium called OCT. Polyethylene glycol and polyvinyl are the constituents of the medium. So then we put, okay, so this is a disc. You put the tissue here, then you froze it -20 to -30 degree, so such a low temperature. You freeze this, and then you put the medium on it, the polyethylene glycol, and polyethylene glycol is a freezer, and then polyvinyl alcohol, you put this on the tissue. So then it is like it gives you a tough structure which is frozen. Then you cut this with the microtome, thin slices, okay, and then you take one slice and see and put it on a smear glass, and then yes, you put the uracil hematoxylin, and then you can wash it under the microscope. Okay, so this is the how you do the how the specimen is fixed. So you can easily say in the station, that okay, so first of all we take the tissue, we put it on a tissue disk, and then we can freeze it under -20 to -30 degrees centigrade, and then we fix it with a medium, for example the polyvinyl ethylene glycol and polyvinyl alcohol, and then we cut it to microtome, which slice it into a very thin slices, and then we see it under microscope. Yes, so these were the steps basically. So what is the advantage of frozen section? Frozen section technique shortens the time to make a preliminary diagnosis significantly from traditional tissue biopsy preparation and margin clearance of a resection or excision. So this is very easy. Frozen section has a hell of advantages because it really tells you everything intraoperatively, and it gives confirmation that yes, your margins are clear. What other alternative to frozen section? Mohs microsurgical micrographic surgery. So it's a modified form of frozen section. Why is formalin widely used for preserving tissue samples or tissue fixation? So formalin, why formalin is used for tissue fixation or preservation of tissue? So it links protein molecules together. It links protein molecules together, increasing the rigidity of the sample, making it easier to prepare thin slices for microscopic examination. It also prevents decay and preserve the tissue as long as possible. So number first, it maintains the structure by linking the proteins together. It maintains the basic structure. Okay, and then what it does, it is very easier to make it into thin slices because it is makes the tissue or makes the sample rigid and stiff. So it is very easy to make it into thin slices. It also prevents decay and also preserve this tissue as long as possible. Okay, so what is the immunohistochemistry marker for squamous cell carcinoma? So it is cytokeratin S100. Cytokeratin S100. And let me ask you something strange. What's the S stand for? This was our famous professor question, that what is this S stand for? So this is up to you, you can search it. So IHC marker for squamous cell carcinoma is cytokeratin S100. Nice to know. For example, this is pre-malignant condition squamous cell carcinoma. So these are the pictures we have shown, that how this looks like. So this is actinic keratosis and squamous cell carcinoma in situ, and this is bone disease. So squamous cell carcinoma in situ, also called bone disease. And yes, okay, so earlier I said that keratocanthoma. So keratocanthoma is not actually the squamous cell carcinoma in situ, but it can progress to squamous cell carcinoma. So this is erythroplasia of Currat, squamous cell carcinoma inside of the glans penis, also called Paget disease of the penis.